My name is Elizabeth Loggers. I'm an associate professor at the Fred Hutchinson Cancer Center in the Clinical Research Division. I'm also the medical director for palliative care here at the Fred Hutch. And today I have the pleasure of speaking with you about palliative care. I don't have any disclosures for this lecture. And here is the agenda for the talk. Basically, we'll first talk a little bit about cutaneous lymphoma, and then I'll describe what is palliative care and how palliative care might be helpful to you and the people that you care about. And then I'll end with some patient stories. So first, as you know, primary cutaneous T-cell lymphomas are a heterogeneous group of non-Hodgkin's lymphoma that primarily affect the skin. And mycosis fungoides and Sézary syndrome are the most common forms of CTCL. There are also cutaneous B-cell lymphomas, or CBCL, uh, and together, these kinds of rare skin lymphomas make up about 4 cases per million people. They're more common in men, and people can live for years with these illnesses. And as a palliative care provider, one of the things that I always try to do is really understand the disease process that's affecting the people that I am working with. And so we do go to the literature and we try to understand what's already been published about the kinds of things that might be specific or unique to the experience of someone with a primary cutaneous lymphoma. And so here is just a general overview of some of the things that we find in the literature and that you may have experienced yourself if you have this condition. And here, when we look at on the left side, these are physical symptoms or problems. And I would include in that wound care and dressing changes, things like that. On the right, these have more to do with kind of the emotional or psychosocial experience of having a cutaneous lymphoma. And mood here can include depression, anxiety, existential distress, and worry. We know that there may be gender differences also in the experience of a cutaneous lymphoma, with some studies suggesting that women report worse physical and emotional well-being, but no real difference in their social or family well-being and functional well-being when compared to males. And this is a quote from one of the papers that's been published about cutaneous lymphoma, basically just highlighting again that people are worried, who have these conditions about disease progression, about symptoms. They may have, significant reactions to having the illness itself, like anger, frustration, and they may actually also experience it in a positive way, where having a serious or life-threatening illness can also lead to certain experiences that might have great meaning and might actually change our life in positive ways. And so we as a palliative care providers also think about this very carefully. We know, for example, that depression or anxiety were identified in 58% of those with Sézary syndrome and 34% with mycosis fungoides or MF. I also like to just acknowledge that caregivers, people who are, participating in the care of the individual with cutaneous lymphoma, they also have a very specific experience. And it can include hands-on care of the individual. It can include psychosocial and emotional support. It can also lead to changes in their roles in the family. That's for the patient and for the caregiver, and in their social circles, like among friends or at work. Caregivers can wind up being advocates and care coordinators. They can participate in decisions and really contributors to medical knowledge, especially at appointments with clinicians who may be really experiencing this illness for the first time at the same time that they're trying to provide, good care for the individual with cutaneous lymphoma. So we acknowledge and we accept that this is an experience for both the individual and for the people around them who are sharing the serious illness experience. So what exactly is palliative care? I've used that word a lot, but what is it? Well, when you're living with a serious illness, there's a lot that's going on. And we think of palliative care as an extra layer of support for you and your family or the people around you who you care about. Our hope is to get to know you over time and understand what's most important to you. And when we get to know people, then we actually can help address their concerns, working closely with their healthcare team. So palliative care never takes the place of the primary team that's helping with the illness, like at the Fred Hutch, for example, that might be an oncologist or a hematologist, but we work in close concert with them, trying to optimize your experience. So that can include reducing symptoms, improving quality of life, and trying to help make living with a serious illness just a bit easier. And it's important to know that palliative care providers are doctors or nurse practitioners, physician assistants, nurses, but in general, they've all received additional training in communication, symptom management, and the challenges of coping with serious illness so that they can be this extra layer of support by bringing this extra training to bear on the experience. So as palliative care providers, we understand that symptom management is not one size fits all. Everybody is different, right? So we try to take the time to fine tune medications until we find the right one or the right combination of things that actually work for you if we're going to use a medication to help with a symptom. But we take a multi-pronged approach, and sometimes non-pharmacologic interventions, so non-medicines, but maybe other ways of managing what you're experiencing could be helpful. And our goal is to manage any symptoms in the way that is best for you, in the way that seems to best achieve the goals that you have. We also hope, though, to avoid extra visits to the clinic or the emergency department or the hospital so that you can spend more quality time with the people that you love and doing the things that you care about most. We know, though, that serious illness can really impact our mental health. And as I mentioned before, we know that this is true for people with cutaneous lymphoma. Quality of life can be significantly impacted, and mood, as we talked about, depression, anxiety, existential distress, or demoralization, can all be things that people are facing. Living with the uncertainty of a serious illness can cause a lot of distress, and so we want to be there to understand what your concerns might be and help find ways to help you cope. We work closely with social workers, psychologists, and psychiatrists. And often on a palliative care team, you will have a social worker and possibly a spiritual health clinician to help manage these things for you, as well as for the people who you love, who are helping you with this experience. Finally, palliative care clinicians also take a lot of pride in identifying any unmet needs and trying to get you connected to the right services for you. So this might be behavioral health, like we talked about, or a specialist even beyond ourselves if there's a symptom that we are not able to fully control or that we think might be better managed by a different specialist. But we also refer frequently to, for example, people with expertise in nutrition, or the rehabilitation, such as physical therapists, or integrative medicine providers like naturopaths and acupuncturists. And so we try to understand the best way, the best approaches to trying to manage anything you might be experiencing, and ensuring that that if we need to bring other experts onto your team, that we get you to those people. Palliative care providers also really value communication with you, but also with your team. And this is key to getting high quality care, and we try to support that. So sometimes, as a patient or a caregiver, it can just be hard to know, who should I talk to about this particular problem? And so palliative care can be another team that's available to you, one call to try to get answers to your questions. We try to guide individuals as well. So if you're sharing with us a concern, we may actually suggest who is the right person to help you with that concern or that question. We can also help complete advanced care planning documents. So these are documents that help your healthcare team understand the kind of care you want and don't want, particularly if there were ever to come a time when you couldn't speak for yourself. And we recommend advanced care planning for all adults, regardless of age or health status, especially the completion of what's called a durable power of attorney for healthcare. This is a legal document that gives an individual in your life permission to make those decisions for you if you can't make them for yourself. And this document typically needs to be witnessed or notarized, and palliative care providers are really good at helping you get these documents done and completed in a legal way and into your medical record, so everybody knows who's helping you, who's involved in this process. It's also important that you have a say in the healthcare that you receive. So one of my colleagues often refers to healthcare as like a speeding train that's rushing down the track. And sometimes people just really don't know who's in charge of the train. How do I know where I'm going? When do I get to stop? Can I get back on? What are the choices, for example, that I have control over? And so we can be that sounding board for you and help you clarify, what do I really want? And can I talk with my other healthcare providers about this? We of course always encourage you to talk to your doctor and the other clinicians involved in your care. We can offer family meetings to try to help bring in the people that are important to you so that they also have the best understanding of your illness and can help you get more of the care you want and less of the care that you don't want. So that's just a quick overview of kind of the main things that palliative care providers typically help with. But again, we try to ensure that our involvement with the patient and their family is tailored to them and to what's important to them. So it's never one thing. It's whatever is important in that moment, and this can change over time. And sometimes that palliative care relationship is longitudinal and goes on, for days, weeks, and years. Other times we come in and out of people's lives only when they feel that they need us, and all of that is perfect. It's whatever is best for you. But now I'd like to share a couple of patient stories and quotes that illustrate how palliative care works alongside your healthcare team to help provide the best possible care. So this is just one example of a case that happened on our team. John was an individual who had nausea and vomiting, and it really hadn't responded despite multiple medications. And he was referred to the palliative care team for assistance with this symptom. And while he'd reported having daily bowel movements to his other clinicians, as our team talked with them more about this, it was really discovered that these bowel movements were really small and that he never really felt like he got everything out during the complete evacuation. And this is a problem that palliative care providers hear about all the time. The clinician who was involved in the case looked at the CT scan and realized that there was just a lot of stool in there that hadn't really gotten out. And radiologists, this isn't something that they would typically mention on a report because that's not why the scan is typically gotten. So our team worked with that person to kind of help get all of this out of their body and find a bowel regimen that was going to work. And this actually, in turn, improved his nausea and vomiting, his appetite, and really got John feeling better, and all just because of some constipation. But if you don't realize that that's the problem, then sometimes, you can be treating this other thing, the nausea and vomiting, without actually getting to where you want to be as an individual with a serious illness or as a caregiver, where, you can imagine as a caregiver, you're doing everything you possibly can. And why isn't this getting better? Well, sometimes it can be things like this, and this is the kind of situation where palliative care hopes to be able to step in, identify the problem, and really resolve it if it hasn't been resolved previously. So now I'm going to just share with you some quotes from different colleagues and patients. One of our patients said, people often tell me that they have a hard time believing that I'm as ill as I am. And I tell them it's because I'm receiving palliative care, and it makes all the difference. After 2 years, I feel like they know really what's important to me, and they're doing a great job of helping me achieve all of my goals. And for me, a lot of it is pain management, but that is far from all they do for me. They assess my psychological as well as physical needs in a variety of ways. And I could not be more grateful for this outstanding group of people. So that's incredibly heartwarming, but it gives you an idea of how palliative care can interact with patients and families to just help make a hard situation, an uncertain situation, better. These are some other quotes. I think the one that is really most compelling to me is the one that says, "I wish I had seen you earlier." This always breaks our heart as clinicians to know that we wish we could have met someone earlier in their illness process to help make the whole experience better, and to keep healthcare on track for them. So we just encourage you really to ask for palliative care. Palliative care can happen at any stage of serious illness. It is not the same as hospice care, which is for people who may be closer to the end of their lives. We can really get involved at any time after a diagnosis of a serious or life-limiting illness. And I hope this general overview has given you a better understanding of how palliative care might partner with you, your loved ones, and your healthcare team to help you live as well as you possibly can. If palliative care seems like it might be a meaningful addition to your healthcare, ask your doctor about referring you to palliative care. Or you could also go online and look for palliative care in your community. One resource that might be helpful is a website called getpalliativecare.org. They have an online directory where you can use your zip code, for example, in order to identify palliative care teams in your area. So we hope that you'll consider palliative care in the future, and that your trajectory and your experience of cutaneous lymphoma is as good as it possibly can be. And so thank you so much for listening to this talk today. Be well.